Welcome to Healthcare in Africa. In the series of discovering the improvement of the healthcare deliveries on the continent, a couple of weeks ago, I visited the MMTC, the Mwale Medical and Technology City in Butere in Kenya. The MMTC is a smart city built in the middle of the rural area in western Kenya. Today, I have the honor to sit down and interview the man behind the MMTC. One of the key components of the MMTC is the Hampton Hospital, a 5,000-bed hospital that is equipped with the latest medical equipment to support the medical referral, the medical tourism, and research on the continent. Very much for the wonderful job that you're doing in rural area in Africa.
You're welcome.
Yeah, as a trained medical doctor and epidemiologist, I started my career in rural area in Africa, and I know the deficit and the gap that in terms of healthcare access in those areas. Last April, when I visited the Hampton Hospital at the MMTC, which you envision and really build it in Butere in West Kenya, I was very impressed with
Thank you.
With the standard and the capacity of the hospital, but also with other developments, because you're not building only the hospital over there, you also you're building the entire city.
Yes.
First question is, could you tell me what is your motivation to invest in healthcare in rural areas? What drives you?
Again, thank you so much. My name is Julius Mwale. I'm the principal investor at Mwale Medical and Technology City. It's a $2 billion city in Western Kenya. And Hampton's Hospital is the anchor for this city. And what we've done, to build this city was to respond to the demand, demand within the local area. So you have 180,000 people going to India every year for medical treatment, special medical treatment from East African region. And so we wanted to capture a third of that market and be able to help, stabilize, the healthcare in these communities. So why the rural areas? Africa is growing middle class. So by 2050, Africa will have a majority of its population living in urban areas. So we're going to these rural areas to be able to stem the rural to urban migration, which has pushed a lot of stress and strain on amenities into the cities. And so we're creating new cities which are green, that will be sustainable, keep African culture intact, and then provide basic healthcare to these communities.
Is it a profitable business, or are you doing for philanthropy?
It's profitable. It's philanthropic from its mode of operation, but it's profitable. So the business, it's built around, the need. Who needs to be treated for this. So the local people in Africa, about 30% of people today in this Eastern Africa region live in cities, and then 70% live in rural areas. So it's about impact, and as you do impact, then you impact policy, and then policy changes, makes it sustainable, and becomes very profitable. But again, it's philanthropic because it's, it's uplifting these communities.
How many years do you think it will take before it becomes self-sustainable financially?
Yeah, financially, I'll say the city has different, districts. Districts that deal with shopping and dining. You have golf districts, residential areas, and then you have the hospital. You have the power plant. So the power plant is already sustainable because it supplies power to the city. People pay for it. Hospitals pay for it. The hospital, it's being expanded to a 5,000 bed capacity.
So about the hospital, what is the next step for that? Are you going to transform it one day into an academic center, or what are your plans?
So it's a teaching hospital. So we're looking at the hospital to become the main teaching hospital, in Africa. So 5,000 employees for the hospital. We'll have up to 2,000 physicians, and then another 3,000 support staff and nurses that are going to be based at the hospital. So this will be a teaching hospital, the biggest one in Africa, and one of the biggest ones in the world. Sudan.
Very impressive.
Thank you.
Do you have a plan to expand it to other countries?
Yes, exactly. So in Kenya, we're in the western region of Kenya, Lake region, 16 million people. So you can imagine Kenya with a population of about 50 million Yeah, 16 million people, about a third of the population, live on Lake Victoria. And that region was, underdeveloped and rural. Yeah, main development in Kenya is along the coast in Nairobi. And Nairobi is a central area, but has 8 million people in the counties that, surround it. So the bigger impact of the population of Kenya is around Lake Victoria with 14 counties, 16 million people. And we are expanding in this area with 82 locations, clinics for telehealth. And then from there, we're expanding to Africa. So we have 18 locations. We're building this Hamptons Hospital in every single location in these 12 countries, in 18 locations in Africa.
Wow.
Yeah, thank you.
Wow. Yeah, from my visit last April in Butere, I learned that the hospital is also hosting a cancer center and also a research center. Could you elaborate a little bit on those two activities?
Yes. So the hospital, Hamptons Hospital, has 24 departments. Of those departments, 19 are already operational, and we're expanding in other 5, like dermatology, nephrology, ear, throat, and eye, the eye department, and the burn unit. So those ones are not operational yet, and we're expanding there to have them operational by the end of this year. But the other departments are open, including the cancer center, and then of course you have radiology, which are part of the research park, of the hospital. So we are building it to become the largest oncology center, in the world, not only in Africa. But as we're expanding with the demand, as we do the studies in the community, as we get their community health department to go in the community, get the cancers that we have in the community, like the throat cancer coming from the herpes virus, we're expanding, to be able to counter the pandemic that we have in East Africa and all over Africa. So it's bringing in all the medical tourist patients for cancer treatment, primarily in Africa, and then allowing other people that want to come in from Israel, for example, getting people from Israel, United Kingdom, Spain, and Middle East, they're coming in for treatment in this hospital today.
Okay. What kind of research will be conducted over there?
So we have tremendous amount of research. So we're beginning with research, first of all, in the bioreactor research, which is doing vaccines, doing drug manufacturing, like pharmaceuticals. We're working on that. As we speak, we've been working on expansion into getting like a bioreactor out of a sugar factory, which is within this area. And so we want to do a lot of research on that. We have infectious disease research. We want to collaborate with other research centers, within the region. There's the United States CDC and Walter Reed in Kisumu, and so we are working on collaboration on that. And some of the leading people in infectious disease in the world are the people running this program. That we're working with based on our affiliate, research center in the United States.
Okay, that's really interesting.
Thank you.
So what is the process like for international patients? I mean, patients that are not Kenyan that want to go and have a treatment at Hampton Hospital in Butere in Kenya. What is the process for them?
So the hospital is the main anchor in this city. And so there's accommodation, there's shopping and all that. So if the patients are coming in, they will stay in the city, in this Mwale Medical and Technology City. And so the patients need to go to www.hamptonshospital.com. There's a procedure that they can basically follow by filling the form and submitting the form, and our department, our Human Affairs department, will be able to contact them and then book them for an appointment that they want to be able to see. And we can also welcome visitors who are medical tourists coming with these patients. They can come do other activities in Western Kenya. We have the Crying Rock, we have Mount Elgon, the largest peak in Kenya. We have Lake Victoria, largest freshwater lake, the tropical lake in the world. The activities there. You come with your patient, you can be able to sample all these activities in Kenya, and of course we could take you to Masai Mara. You can fly right away from either our city or outside our city in Kisumu to flights in Masai Mara every day. So we welcome all international visitors with their patients, to come in and sample our services.
So what is the cost like for international patients?
So the cost is very affordable. We are a little bit lower than India, the costs that are treated for medical hospitals in India. We are lower than the biggest hospitals in Nairobi. So the Western Kenya cost is, for example, if you're coming in for treatment, you have insurance, you're going to pay for the diagnostic services about $30. So if you're an international patient, that's what you're going to pay for consultation. Yeah, you know, and then the treatment, you know, depends on your insurance. Yeah, but you know, you can always organize to be able to have the insurance program or credit program or other financial incentives available for the hospital that is given to patients. We don't turn any patient away. So we treat everyone that visits the hospital.
There are many medical doctors in Africa that send their patients for treatment abroad, like you mentioned.
Yeah.
So in case doctors in other countries want to send their patients to Butere, the Hampton Hospital, what is the process like for them?
Yeah, so there's a referral process, you know, for consulting patients and consulting physicians. Yeah, if they have patients, they can contact directly our hospital. Again, our website is www.hamptonshospital.com. There's a referral department on our website, and then you'll go through the referral process. So you can bring your patients and you can get information, work with our doctors, and you'll be able to go through that procedure completely.